Gingivitis and periodontitis. Know about causes, risk factor, sign, symptoms, prevention and treatment of gum problems. Gingivitis and periodontitis is very common. Dental problems can be associated with bleeding gum. Bleeding gum causes bad breath or bad smell from the mouth. If you are getting these problems, then immediately visit a dentist. If you are having gum bleeding, then it can be cured. An early stage of gum disease causes swelling of gum, and later it can cause pigmentation or black spot on gum. If not treated, that it can cause bleeding gum and then a periodontal problem, loss of a tooth. Gum or gingiva is the supporting end which surrounding tooth. Gum disease, also known as gingivitis and periodontitis, is an infection of the gums that surround the teeth structure. It is also one of the main causes of bleeding gum and tooth loss among adults. There are two major stages of gum disease: gingivitis and periodontitis. Gum disease can increase space in between tooth, causes increased gap in between tooth. If this problem is untreated, it can cause tooth loss. What are the causes of gum disease? Gum disease can be caused by a number of factors, but poor oral hygiene is the most common cause. Mainly dental plaque and calculus causes gum problems. Your mouth is full of bacteria that combine with saliva to form a sticky film known as plaque, which builds up on your teeth. This plaque later becomes hard on the tooth. It's called calculus. When you take food or drink high in carbohydrates, sugary or starchy foods, bacteria in plaque turn carbohydrates into the energy they need, producing acid. This acid causes irritation of gums, making them inflamed, and gum disease. Plaque is the soft depositions that form the biofilm adhering to the tooth surface or other hard surface in oral cavity. Dental calculus is an adherent, calcified or calcifying mass that forms over the tooth structure and dental appliance. The plaque later on becomes the dental calculus. Dental plaque equals bacteria plus intercellular matrix. Periodontal infections are usually mixed, most often involving anaerobes such as Treponema denticola and Porphyromonas gingivalis. The microaerophile Actinobacillus actinomycetum comitans causes a rare form known as localized juvenile periodontitis. What are the risk factors of gum disease? Poor oral hygiene, diabetes, tobacco, a family history of gum disease, age. Gum disease becomes more common in older peoples. Malnutrition and vitamins deficiency, weakened immune system, HIV and AIDS or certain malignancy, chemotherapy and radiotherapy, malocclusion and traumatic occlusion, hormonal changes in girls or women. What are the signs and symptoms of gingivitis and periodontitis? Gum disease generally painless, so be aware of any of the following signs and symptoms. Early symptoms will be swollen and red gum. Later bleeding gums, dull pain and tenderness. Gums that move away from the tooth. Tooth sensitivity. Increased space or gap between teeth. It can cause food impaction and later it may lead to infection and caries. Persistent bad breath or bad taste in mouth. Loose teeth. Visible or invisible pus surrounding the teeth and gums. Periodontal abscess. How you may prevent gum disease. Rinse mouth with water after every food. Sometimes use chlorhexidine mouthwash. Gargle with warm salted water 3 to 4 times in a day. It generally helps to the infection. Stick to gentle, twice daily brushing with a soft bristle or electric brush. Use proper toothpaste. Use proper toothbrush and toothpaste. Use floss once daily and you can massage gum with your finger. Avoid tobacco and betel nut. Chewing habit of little hard and fibrous food is a good habit. Don't take always soft or liquid food. If you will chew, then blood circulation on gum will increase and you can get healthy gum. Take balanced diet. Schedule regular dentist visits for plaque and tartar removal. Every 6 months visit dentist for scaling treatment, for prevention of gum problem. If you are having the orthodontic problem, malocclusion, you may affect with poor oral hygiene and gum problem, then get the orthodontic treatment. Treatments of gingivitis and periodontitis. Antiseptic mouthwashes containing chlorhexidine is given or betadine gargle is recommended. Oral prophylaxis scaling for gum disease or root planning needed for periodontitis. For gingivitis and periodontitis, scaling is the primary and important basic treatment to remove the causative factor plaque and calculus. If you have severe gum disease, you may need further treatment, such as periodontal surgery. Commonly antibiotics like metronidazole, doxycycline, amoxicillin is used upon the condition, a painkiller used to reduce pain. Take medicine after dentist advice. For severe periodontal problem, surgical interventions needed. If none of these other gum infection treatments works, your dentist may recommend surgery. There are several surgery options, including a gingivectomy, flap procedure, or even a tooth extraction.
Visit our website www.medihelp365.com to find doctors, hospital, medical service provider informations, read useful medical articles and lots more. Subscribe our YouTube channel Medical Help 365 Days to see medical related useful medical videos. Press bell icon to get instant notification.